Alberta has come under a lot of criticism after announcing it will lift all of its COVID-19 restrictions, even as cases continue to rise. As of today, contact tracing will largely be the responsibility of the person who tests positive. Asymptomatic testing will no longer be recommended. On August 16th, the province will be dropping its mandatory masking orders. And that same day, Albertans will no longer be required to isolate if they test positive for COVID-19. It will simply be a recommendation. Dr. Theresa Tam was asked today why provinces would be making these moves now when her office is warning we're at the beginning of a fourth wave.
For chief medical officers, they're all thinking, well, people have learned a set of personal habits and behaviors to reduce the risk from not just COVID-19, but other respiratory infections, and that these kind of good habits should continue, including obviously staying home if you're sick. I would say adding another layer of protection, such as wearing a mask, could help.
Alberta's Chief Medical Officer of Health, Dr. Deena Hinshaw, has written an op-ed apologizing for causing confusion, fear, or anger, but she's standing by her decision to lift the COVID health orders in Alberta, and Dr. Deena Hinshaw joins me now. Thanks for taking the time, Dr. Hinshaw.
Thank you for the opportunity.
You know, this won't come as news to you, but a number of medical experts have criticized your decision, including the Canadian Pediatric Society and the Alberta Medical Association. So, you know, why are you confident that this is the way to go at this stage in the pandemic?
Sure, and I just want to be clear about the process in Alberta. So I make recommendations to cabinet committees, and then their decision is what informs policy. And then the orders that are carried out are the tool that implements the policy decision. So just want to be clear that there's always that interplay. And the recommendation is certainly mine. So in terms of why I believe this is the right step for Alberta at this time, it's really twofold. One is about I believe I have an obligation to continually assess the proportionality of the requirements that I place on Albertans province-wide in terms of legal mandates to do or not do certain things. And I need to continually assess the province-wide risk and whether or not that meets the test of requiring those particular interventions. So as you may know, the majority of public health measures were lifted on July 1st. We have been watching cases since then. There has been, as you mentioned, an uptick. We've seen our acute care admissions holding roughly steady. So we know that the vaccination that we have widely available can disrupt that connection between cases and severe outcomes. And so we, like Saskatchewan did on July 11th, are planning to lift that provincial-wide mandatory requirement for isolation and quarantine. And as BC did earlier in July, lifting the mandate province-wide for masking in transit, taxis, and ride shares. We will be maintaining some specific measures in high-risk locations like acute care and continuing care. And so there are measures in place that will not be changing. And at the same time, we're going to be moving from that province-wide approach to really looking specifically at local interventions where they're needed. So if we have surges of cases leading to acute care impacts, being able to target those particular locations with measures that are needed, as opposed to, again, the mandate at a province-wide level.
What do you say to people who just say it just feels like it's too soon, that we aren't there yet broadly? I mean, the Canadian Pediatric Society called it completely out of step. I mean, are they wrong to frame it that way? And to those who say it's just too soon? And it's fair to point out, by the way, as you did, that you're not, Alberta is not alone necessarily. Other provinces have done some aspects of this. But here we are. I think that's why people feel this way, that it just feels like we're not there yet. What do you say to that?
We've lived through a remarkable and painful time together over the last year and a half with respect to the huge impact that COVID-19 has had and the impact that the restrictions have had. And I think that we have become accustomed to. We've relied upon some of those basic infrastructure pieces like testing, contact tracing, and case investigations as a part of what's helped us feel safe. COVID has taken away the predictability that we used to feel we had in terms of our daily routines. So it absolutely is something that is concerning, and I recognize and acknowledge that this is a big shift to make. It's a very rapid shift to make, but we know that this fall we will see other respiratory viruses coming back again, things like influenza, things like enteroviruses, rhinoviruses, RSV, and it's important to think about not just the impacts of COVID-19 on that infrastructure we created to manage COVID-19 pre-vaccine, but also what impact will it have when we see all sorts of other viruses that cause exactly that same symptom picture. And so you quoted Dr. Tam earlier, and I would echo her words that the things we've learned from COVID, we need to take forward in a sustainable way to help us with all those other viruses. But the current system we have with widespread testing for even mild illness and the significant investment in a widespread contact tracing is not something we can live with for years to come. So I guess the question would be, if we don't make this shift now to move into this new approach to reinforce some of those basic critical habits, including masking, which continues to be a very reasonable and important part of overall protections. If we don't help people make this shift now, the question is when would we make this shift? When would it be more appropriate? And again, I think there's no perfect answer. There never has been in this pandemic, but we do need to think about COVID as one risk among many and not as the dominant risk that everything needs to focus on, because following status quo, I believe, has risks of its own.
Sure. If I can just jump in, though. I mean, you've just tweeted that in the last 24 hours, nearly 397 new cases have been identified in Alberta. That's a lot, right? And meanwhile, after August 16th, routine testing will no longer be available for most people in your province. Won't this hurt Alberta's ability to react to outbreaks or even be a factor in further outbreaks?
One of the advantages that we have is an investment in wastewater surveillance infrastructure. And so we have the ability to do testing in high-risk locations like continuing care, acute care. We have the wastewater surveillance program that's been running for a year that we know how it correlates when it comes to trends between how wastewater correlates with that particular region's testing rates when we were running this overall testing program. We also are operating a Sentinel surveillance network of primary care physicians that we're working to expand. So we have that community snapshot as well. And again, I think the important thing to remember is that our approach that we are currently running is diverting public health resources almost exclusively to COVID-19. We have, unfortunately, tragically, babies dying of congenital syphilis. We have our childhood vaccination rates for other vaccine preventable diseases dropping, putting us at risk of other vaccine preventable outbreaks. We have cancer screening rates lower. There are other things that are a significant risk to Albertans, and the longer that we focus on COVID, especially at this point in time when vaccines have again disrupted that automatic case to acute care ratio, again, I would not believe that I would be doing the best service to Albertans if I didn't look at that bigger picture and make recommendations looking at that bigger picture of how we utilize the people in our public health system for the best impact for everyone's health.
If I could just look at one more change upcoming in Alberta as of the 16th, no longer requiring self-isolation for positive cases, just recommending it. So to Albertans who might wonder, will I feel safe in a public space when you're not mandating that those who know they have COVID to stay home? Do they have a right to wonder, will they feel safe?
Again, I think people have really relied on that system that we have had in place as a critical element of feeling safe. And I feel it's critical to be able to emphasize we're not taking away all aspects of our COVID response. We're going to be focusing on that local picture. And so using things like wastewater surveillance to give people information about what the local risk is at any given point in time. It's important to know that when we look at our serology studies that we've done over the year, and we look at our PCR testing results, that our approach has only ever captured about 1 in 4 of our overall cases. So it never has been 100%. And I think people need to know, even now, even prior to that mandatory isolation being lifted, again, there's no guarantee, and people are much better off looking at what is that overall transmission pattern in their community, where again, we do have that wastewater surveillance we will be making public, and that is going to help inform them what that active risk is. I also believe that people who test positive for COVID-19, I believe that there are very few people who actively want to harm others. And so we know, again, what we need to do. We need to stay home when we're sick. For those who are diagnosed with COVID-19, staying home for that full 10 days. And again, those are the pieces that, as Dr. Tam mentioned, are the habits that we need to continue.
The Alberta government saying this decision is based on science. I think you've said that here. I mean, you know, the federal health minister is saying that she wants to better understand this. Will you release the data on which this decision was made?
We are working to put together the modeling that we've done that indicates the expected numbers. So we do expect the case numbers to rise overall for the coming weeks. We do expect those to peak in the early fall. And all of the forecasting scenarios that we've run with Delta-specific parameters, none of them have indicated that we are seeing an overwhelming surge in the acute care system. So again, it's about not just the COVID data, but looking at all of those other risks as well, and recognizing that staying the course on status quo is also a risk, because it doesn't allow us to redistribute those resources to address some of the other health issues that Albertans have.
And just lastly, are you locked in on this? In the face of the criticism, you're staying the course?
What I think is important right now is that people understand the rationale and the data that we use to inform, that I use to inform this recommendation. But of course, with COVID, we always need to monitor. We will continue to monitor and adjust as needed. It would be foolish to say with anything with COVID that we know for sure what will happen next. And so again, we'll make sure that we're continuing to watch closely with those tools that we have at our disposal, and at the same time be continuing to make sure that people have easy access to what is the reason that we can contemplate this, which is the life-saving intervention of vaccine, and making sure people have access both to evidence about the vaccine as well as being able to receive it.
It is such an important matter. I thank you for your time, Dr. Hinshaw.
Thank you for the opportunity.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.